53 to 55% of whole blood is plasma. The majority of that is water, but that 10% is a rich cocktail of proteins, hormones, cytokines, most importantly, these amazing extracellular vesicle or exosome.
If your brain stays healthy, your mitochondria stay healthy, then everything, your immune system's better. Obviously, your cognitive function, your brain's better, you age slower, it affects everything.
Exercise has so many powerful pathways that allow us to be optimized.
A lot of our thyroid cases, they have what we call cavitations. That they get teeth pulled as a kid, say, and then it heals over, but a cavitation forms. An infection lies there, and man, does it affect the thyroid.
We know now aging is the biggest cause of morbidity and mortality.
Wait till you see my next guest. Oh, you'll never guess how old she is. So we're going to talk about everything anti-aging, because whatever she's doing, you want, I want, we all want, but we're going to have a great conversation. She has one of the top regenerative clinics in the nation in Austin, Texas. And my next guest, I can't wait to talk about all these anti-aging tricks that you do, but Dr. Khanh Nguyen, MD medical doctor, and wait till you hear her story. Oh my gosh, wait till you hear her. We're going right there. Okay. But listen, Ben Greenfield said, Dan, you have to interview her. And you have to go see her because you need to do all the stuff she's doing in her clinic. We're going to talk about all of it. Some plasmapheresis, all of it. I can't wait. So welcome.
Yeah, I'm so excited. I mean,
all right. I already got like a frog in my throat. So, all right. Isn't she amazing? Did I lie? Okay. Can I tell him your age?
Sure.
Yeah. She'd pause. So maybe I shouldn't. You know, you should be proud. You should be proud.
I am. Yeah.
She's 58 years old. Not long, just won literally a physique contest. And, you know, maybe we'll have you stand up because she is rock fit. I'm telling you, she is amazing. My assistant said, what she's doing is working. And so we're going to find out everything you're doing. I can't wait to do that. But first, you have an incredible story. Your family, you grew up in Vietnam. Mm-hmm. Okay, well, partly. And then you came to the U.S. I want to hear the story. I can't wait. I've been waiting to ask this. How you came to the U.S.
Yes.
So I should say it this way, how you ended up in the U.S., how you got to the U.S., because that's an incredible story. I read a little bit.
Yeah. So it's just a jump of faith. And
I love that already.
I mean, it's just like ignorance and faith. So I was born in Vietnam, family of 6. My dad was a physician, so the plan was for me to follow his footsteps because I knew from day one, very, very early on, that I wanted to be a doctor. But in 1975, when the communists took over, my dad was taken away to the re-education camp because he used to work for the U.S. Army as a physician.
So re-education means you're going to believe communism, we're going to make, and I'm sure there's a little torture involved there.
Right.
That's typically what re-education means.
Right.
Did that happen?
Right.
Oh my God.
Yes, that did happen. So that's another whole story. So
did he survive it?
He survived. He escaped. And then ultimately, I sponsor my whole family here.
Wow.
But initially...
How long was he in this camp?
In the camp.
So my curiosity just gets
so
the
he
best
was
of me.
in that for years.
Years.
And then he got out, and then the whole family trying to escape. And then to escape Vietnam, and he got caught again.
Oh my God.
So finally, we only have enough gold for my older sister and myself. So we get sent off. Actually, I begged my mom. I'm like, she only have enough gold for my older sister. And I
said... Gold,
like
physical gold?
Yes, because you have to pay. And I said, please let me go because I need to take care of my older sister. And so they said, oh, she's small enough. We'll let her tag along. And so we, it's supposed to be a ship. We just sneak out in the middle of the night, and when we get to the river... So you asked your mom
permission to literally go to the U.S. with your sister?
Mm-hmm. Yeah.
And how old were you?
I was 13.
Oh my gosh.
Yeah.
So that was probably hard for your mother to let you go. And how old was your sister?
She was 15.
Okay. So letting your two 13 and 15-year-old girls get on some boat
Right.
and go to the U.S. where probably the chances were greater you'd get caught.
Or
and
get
then in
raped.
prison. Or get raped. Yeah, of course. Yeah.
It's a lot of that going on.
I can't even imagine, but
Right.
she let you go.
She let us go out of desperation. And
She was probably on her knees praying a lot.
yeah, and so, but it turned out to be a little raft when we arrived to the riverside.
So wait a minute. So you expected a ship,
Right.
but it was a raft.
Right.
Describe the raft.
It's only big enough to fit 20 people.
Okay. And was it air?
And there's no, well,
Like
no,
rubber?
no,
Or was it like a wood?
It's wood.
Okay.
But there's no engine. There's no
No
water.
engine. So wait. Hold on.
Yeah.
You're going to go across a body of water. What body of water?
The ocean, there was the whole story was that it's tiny. So most people turn around, like most adults turn around. And there's like 19 people that jump on the boat. And the guy was saying goodbye to us. And he's like, well, for all of you that's staying behind, wish us luck. After hearing that, I'm not staying back. I really want to go and find my freedom, have a chance to become a doctor. Really, I would just laser focus.
You had a goal. And you weren't going to let anything.
Right. So he pulled up the anchor. The boat was drifting, and I jump over the last minute. And of course, my older sister had to follow. So she jumped, and then she got in the waters. We had to pull her up. And this is in the middle of the night.
But you were in the boat. Mm-hmm. But why did you jump out?
No, I jumped on the boat, and my sister followed me.
Oh, okay. So they pulled up the anchor. You weren't on the boat at this time.
Mm-mm.
Okay. I got that screwed up. Okay.
Right.
And then literally they're like, okay, anchor's up, let's go. And then you quickly jumped in.
Right.
And your sister tried to jump in, ended up in the water. You pulled her up in.
And then by morning time, we realized the engine broke or out of gas. I don't know. There's no engine. And there's one container of water. It got knocked off. It's no food, no water.
Food, no water, no gas,
engine.
no engine.
Right.
And how long was the journey supposed to be?
We were floating for 7 days. And
did you have oars?
No.
Wait, 19 people on this thing?
Yeah, so 21, the two of us. And my little raincoat, we used that as the sail. And then I told my sister, I'm like, I'm so sorry that you follow me, and now look at us, we're just drifting. But don't follow me anymore. If we get stopped by the pirate, my plan is I'm going to jump in the water, but make your own plan, because I don't want to be responsible.
But you're the younger sister, though. But you're acting like the older sister.
Right.
How did that all happen?
I was just very serious and very focused, and I always have a plan.
Yeah. I just love you for that. All right, so here you go now. 7 days floating.
Right.
Pirates out here.
And luckily, none of that happened. It's really a miracle. The ocean was like the swimming pool. We would never survive. And we did. So that's why I said it's ignorance and desperation and faith, because I just knew I wanted to get out. I wanted to have a chance to become a doctor, and didn't want to stay back. And didn't think much further.
That was not an option. I don't know if I'd have done that. Anyway, so you're floating. What did you float to?
So we drifted to Malaysia.
Okay.
And I was the first one spotted land, and then there's no wind. So we just hanging out for hours. And but
you could see, hoping we need to get there.
Right. So I threatened to jump in the water and swim in. And luckily I didn't. The Red Cross came out and dragged us in. And by the time we got off the boat and, land on the sand, everyone collapsed, right? Because we have to hold on to our pants because we lost so much weight, and 7 days in the ocean, so we all collapsed.
13 years old.
Yeah.
Everyone
I made it.
And then Malaysia, the government took you in.
So from Malaysia, I got transferred to the Philippines, to the refugee camp.
Okay.
To learn about, the way in America. That's where I learned English.
The way in America, I mean, why were they teaching that in the Philippines? I mean,
because in Malaysia, they kind of sort out, because my dad used to serve the U.S. Army.
Mm-hmm.
I carry his ID number, so then we are qualified to go to the U.S. And then before that, we just had to learn English and, just be oriented.
Wow. So because your father was in the military, you were able to go to the U.S.
Right.
That's amazing.
Yeah.
And so before they were teaching you English in the Philippines.
Right. Right.
With a plan that you were able to go to the U.S. So how long were you in the Philippines? And then
6 months.
6 months.
We were there for 6 months.
Okay. Crash course in English. And what else did you learn? Like about the United States?
Like the supermarket, because in Vietnam, you go to the market, it's like on the street.
Yeah.
So just, learn about how American live, shopping mall and supermarket. And
I mean, thank God you and your sister had each other, you know? I mean, that was great. And then, okay, so you learned that, and then 6 months later, you get brought to the U.S., I'm sure on this time a ship.
Right. On the airplane.
Oh, on an airplane.
On an airplane.
Even better.
Yeah,
Okay, all right.
We got fancy. And then we stay with
What did that feel like? What was that feeling? Okay, first of all, what was the feeling like when you hit the beach, land? Can you remember what that felt like?
I just remember that prior to that, I was young. I didn't think much about God. But then I'm like, it doesn't matter who you are. That's the moment that you're like, there's something,
God.
Yeah, something beyond us and the protection and all of that.
I don't know how you made it without him because this is all divine, right? It's like, and
even the decision to jump.
Yeah. So he put all that in your heart.
Right.
He did.
Right.
Yeah.
Right. And so, to me, I'm fortunate to get into a situation that kind of brought me to that.
So that feeling on the beach, I mean, it was a feeling of gratitude, but can you remember it? Can you just
I was scared.
Oh.
I'm like, okay, now I'm alive. But then, me always thinking ahead. I'm like, what am I going to do? Like,
right now,
I didn't think ahead, but like even when we get to the U.S., what I'm going to do.
You had nothing. Yeah.
I had nothing. Yeah. And so I remember many days after I would go for a swim on the ocean. It's beautiful. But then I'll be scared, to be honest. Mm-hmm. And one day I remember telling myself, I'm going to stop crying. I'm going to stop being scared. I'm going to put my head down and I'm going to do it.
And how was your sister at this point? Like, I mean, what was her?
She was going through puberty and she's beautiful. She's, boy crazy. But I have to say, when we arrived at the refugee camp, she really grew up and she took care of me. So the story I was telling my mom was I needed to go to take care of her. But the reality, we took care of each other.
Yeah, I mean, 2 years at that age is a big difference, right? I mean, but it was your goal, it was your vision that God put in your heart. At this point, it's not like when you were that age, you didn't even know him at that point, right? You know what I'm saying? It was like, but he put something in your heart, right? I always say God loved me before I even knew him or hated him. It's like, but he knew you. He put that in your heart.
Yeah.
And so it was your vision that got you and your sister there. And then she started growing up and then she had...
and we really took care of each other. Mm-hmm. And then, from that day on, I was even more focused. And I started to be even more religious because I wanted to be on the right path and, not being tempted and be distracted.
Yeah.
And so that's really the guiding force.
Still in the Philippines, you're saying, yeah. Did you end up finding out about Christianity, Christ Jesus there in a church? No, you were just praying. You were just, God was revealing himself to you.
Right.
Okay. So now you end up flying to the US, right? Probably excited, but scared because you didn't have anything.
Right. It was a, when you have everything, if you eat your favorite food every day, I'm not sure if you appreciate it that much. But for me, I really literally risked my life. So when I got to the US, I remember, the bus taking us across the Golden Gate Bridge. And I was just at awe with like all the reality and a sense of gratitude, like appreciation. And I'm like, I'm going to make the best out of this.
Oh, yeah.
It's just like such gratitude. It's like, this is like amazing and huge and beautiful.
San Francisco, it's different today, but man, back then, oh gosh, it was an amazing city to come into and like see.
Right.
Wow. Yeah. Okay. So here you and your sister are in San Francisco. Right. Now what?
And then we got relocated to stay with my aunt and uncle because we were still minors. And
so you had an aunt and uncle that's another story, but how did they end up here?
So my uncle escaped right in 1975, and then he sponsored the whole family there a few years before I arrived. So because of that, we, get to stay with them as minors.
And where did they live?
That was in not Northern California. It's in LA area.
Okay. All right.
Yeah.
And what did he do for a living?
He was an engineer by training, but in the US, he worked like a store manager. And so, we live in a small place and we share like one bedroom between my sister and myself and my two other cousins. And I remember apple was the best fruit on earth because we didn't have that. And broccoli and apple was just amazing.
That's funny.
Yeah, and because I could not have enough. And
people that live here is like, oh, why bother with apple? They have all this junk food.
Right. Yeah. And, just to save enough money to buy an apple was amazing. And I shop at Salvation Army throughout, including the suit that I bought for my medical school interview. And that was the big hit. Everywhere I went, like the suit. I'm like,
I wish we had a picture of that. Find it on your phone. You might have it. Anyway, No,
that time there was no iPhone yet.
It's true. Yeah, I meant like a picture of a picture. Like someone took a board.
Yes.
But so there you are in the suit. Okay, so you get the interview to go to medical school, and this is in California.
Yes.
Right. Yeah. But you still had no money, so your aunt and uncle were helping you out a little bit. Right.
So we were in school. Yeah. And then after school.
So you passed the interview. I mean,
yeah.
Exactly.
So that's high school.
So because you were in high school at this point. Yeah.
Right. And then got to USC on a scholarship, and then I got accepted to medical school. And so I was just straight on. I used to live in the library.
Man, if you told that story, I'd be like, yeah, you're in. Pass. Like, I don't care what your SATs are, you're in. But I'm sure you did well in school. You said you were dyslexic, as I am. Yeah. So that means school's not easy for us.
It's just mindset.
Yeah, exactly. That's what got me through.
I work hard.
Yeah,
right.
Me too.
A lot of people can do the minimal and accomplish.
Yeah, not you and I. Yeah, I had to work hard.
I work hard.
But our brains are brilliant in other ways. Like everything I read, it's like reading was so difficult for me, right? But but when I read it, I remember it.
Right.
And I have the ability.
And when I understand it, then I get it.
Oh,
and
me too. Yeah.
Yeah.
Yeah, exactly.
Now, thanks to Audible, now I can listen and I can go through a lot more materials.
Yeah, I know. That's great. Okay, so you're in medical school. Now, what did your sister do?
So she's the only one in my family that is non-medical. So she ended up, she got her master's degree in computer engineer.
Okay.
But, we ultimately, during college, we worked after school. We saved money and we sent home to my family, and then ultimately sponsor the rest of our siblings and my parents to the U.S.
I love hearing that.
And,
I mean, you two little
bought them
girls
tickets.
end up going over. Your mother probably thought you were dead.
Oh, so when we arrived to the Philippines, finally we wrote a letter to my mom. By the time she got the letter, it's like a long time.
Oh my! Like
and she
a year, 2 years?
No, I think it was months.
Okay,
but she didn't know what happened to us.
Right.
So now I'm a mom. I just could not imagine.
She's a superhero. Is she still alive?
She passed away.
Oh, bummer. What age?
Yeah, she was 62.
Oh man, I mean, hard life.
Yeah.
Yeah, hard life. Yeah. And your sister, she live in Austin with you?
She lives in Southern California.
Oh my gosh, you still so close?
We're very close.
Oh, of course.
And then I sponsor the rest, so there's 6 of us. My 2 younger sisters.
I want to meet your sister. I want to like go to dinner with you and your sister, and I want to hear both of your take on this thing. So
it's fascinating.
We'll do another podcast. You're bringing your sister
because we have a different story. We remember different things.
Yeah, no, that's what I'm saying. I want to hear from her too.
I forget all the hardship. I blank out, and then she kept on asking me, "Do you remember this? You remember this?" I'm like, "No."
Yeah,
but it's just the survival mechanism.
Oh, yeah.
I just wanted to,
amazing.
Be strong and just focus on the positive. And that has
is she healthy and fit like you are?
She is. I love the gym. She's fit, but she does fun stuff. Mm-hmm. So she lives to ski and she
That's how you skied in Park City.
Yeah.
Yeah, your sister.
Yeah.
Rides bike, So she's like the outdoor enthusiast, stays in shape.
Right.
I can't wait to hear her take on this story. What an incredible story. Y'all need to write a book. I mean, honestly, this is extraordinary. I mean,
I think, if anything, it's good for my children to know.
Oh, yeah. How many kids do you have?
I have 2 boys, 24 and 25.
Yeah.
And my 25-year-old, when I was little, he wrote an essay. He said, my mom is a slave from Vietnam because he didn't know the right word. And then he said, to the world, she's very small. But to me, she's taller than life.
Oh,
so I'm
my
like,
gosh.
I keep that near to my heart. But I do want my children to, to really have gratitude and to be strong and to have faith. Mindset.
Is your husband from Vietnam? Is he Vietnamese?
My husband is Caucasian. And we met in training. So he's an orthopedic surgeon. He's a hip and knee surgeon.
Yeah, that's amazing.
Yeah.
Wow. Okay. So here we are, right? I mean, now you're in medical school and you come out of medical school. What type of medicine did you want to...
So I finished internal medicine training and I wanted to go deeper to understand the body. So I did a fellowship in critical care medicine. And then after graduation, after I finished training, I spent maybe 10 plus years in the hospital and ICU setting.
I tell you what, that's tough.
Right. Thinking that I'm saving life and I did. But, I noticed people are coming back sicker and sicker with a longer list of medication.
You probably enjoyed the emergency part of it and not so much the chronic stuff, because all you're doing is giving them drugs. They're just coming back with symptoms of the drugs.
So in the ICU, I did a lot of procedures, right? So intubation and putting in central lines and such. And so I thought that, I was very proud and I really enjoy what I did. But then soon I realized it's kind of draining because you don't really make people better. They just were able to get people to live longer, but
not
very
healthier.
debilitated.
Yeah.
They would go from the ICU to the floor and then to rehab, to nursing home. And then, I was busy working, forgetting taking care of myself. And I was driving home from a night shift and I kind of fell asleep. And luckily it's like 2:00 in the morning. I called my husband. I'm like, I got a flat tire, but it was more than that. I fell asleep. Luckily I didn't get hurt.
But you went off the road.
Yeah. I hit the guardrail. And so I had to stop. I had to pause. Shortly after that, I got diagnosed with grave disease.
Yeah, I read that.
Yeah. And actually, I was almost in a thyroid storm. I was like losing weight. Couldn't breathe. Like in between seeing patient, I had to sit down. I had to sit and hold patient's hand because I couldn't walk. And that is another event. It's in life sometimes. It's a crisis and it led you to a different direction.
Yeah, it's like my brain wants to figure out even the causative factors there, right? Because that's what I do for a living. Because I've helped so many people with autoimmune thyroid, right? It's like, and there's typically a perfect storm. Emotional traumas, excuse me, can lead to part of the storm. I don't know what happened to my voice today.
You're just emotional.
So, anyways, man, that water's good. See, that's the best water in the world. I told you that. Drink. Very hydrating because it's the 40 parts per million of oxygen in that water. And I said that's the water I actually have their filtration system in my house. Before I was like, my wife tasted it and she said, "Get rid of ours. I want this." And that's pretty much what happened. Anyway, the causative factors, most of it is neurotoxic in nature. People that end up in a moldy home, not unknowing, and it triggers the gene, boom, 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 right? The emotional, three stressors come together, bam, autoimmune. Right. I put the analogy of a three-legged stool. All three things have to be there. And then you get the condition. A gene gets triggered, but just because you have the gene doesn't mean you get it. You have to trigger the gene, epigenetics. Then you have the stressor, the perfect storm of stressors that turns it on. If you get rid of that, you can turn the gene off. And then there's the gut component, that is typically part of it because it has such an impact on autoimmune. But you could have the lack of just a few bacteria and never even consider yourself having a gut issue. And you don't make Treg cells and that leaves you open. So this three things in that three-legged stool analogy. But here's the thing. If you deal with all three of those, you can turn that gene down, right? So anyway.
And it makes perfect sense, but we're not taught in medical school at all.
Yeah.
I mean, I learned the Treg and, the gut, how it's work, the brain, but it's very separate.
Yeah, separate.
And there's no root cause.
Well, they don't even teach root cause. And then the system's not set up to go for root cause, right? It's set up for symptom, drug, right? And there's a time and a place. Like the emergency room stuff is incredible.
I mean, certain surgery save life.
Absolutely.
When you in septic shock, antibiotics save your life, right? Yes.
Absolutely.
But we have to go way above that and before that.
I can't wait till we get to the regenerative and all the anti-age stuff. We're getting there. But what do you think the trigger of your autoimmune was?
Yeah, so it's just the biggest thing is the physical stress and then the mental stress.
Part of it.
And with that genetic predisposition, that the immune system is lower.
Was your environment good? I mean, do you think you might have had a mold exposure? Could you have had cavitations, like teeth that were pulled, they form over? A lot of our thyroid cases, they have what we call cavitations that they get teeth pulled as a kid, say, and then it heals over, but a cavitation forms, an infection lies there, and man, does it affect the thyroid.
Yeah.
There was a study showing root canals and how it causes thyroiditis and thyroid conditions and autoimmune, but these cavitations can do it as well. So we always have our people do cone beams to make sure they don't have these, but I don't know, maybe.
So now I'm more aware, but back then,
No,
I didn't know. I was not even looking, and it just slowly, one by one, I had to figure out how to feel better, how to heal myself.
So what'd you do?
And I ended up having my thyroid removed because it was
you didn't know,
it was
right? Yeah.
it was, and then I went to see an endocrinologist, and I had to be on Synthroid. And
well, if you get rid of your thyroid, you're going to need some support,
right? And not feeling better, and that's when I'm forced to like pause and ask a better question, instead of like, did I get the right diagnosis? What is the right diagnosis? Then I started to ask why.
That's smart.
Why is this happening? Why is my body attacking my own?
Yeah, that's exactly.
And that's kind of, then I got introduced to functional medicine, and I just never looked back. And I was really surprised myself that things work. Well, my dad was also a physician, and in Vietnam, anything Western is the gold standard, and Chinese medicine, everything else. I was raised that's kind of, voodoo, second rated. But it's kind of like everything is coming full circle to make me realize, you just have to ask a better question and figure out, and not just accept what we're taught in medical school.
Yeah, no, exactly. You had to relearn a little bit, didn't you? Yeah.
To relearn.
But look
everything.
at that, pain to purpose, right? That's been my life. I got sick, changed my career, led me into functional medicine, right? And everything that I teach. Been teaching doctors for 20 years.
Yeah.
That's what happened to you. Changed your whole career, right? Now you start studying functional medicine. Right. You start applying it. You start feeling better.
And I was surprised. I'm like, wow, it does work, right? And
not voodoo.
Yeah, it does work. And then that's when I make a bold move, quit my job. And then I at first I was subleasing space at my husband's office to start small. I just I started doing some PRP injection, a little bit of functional medicine.
And PRP, we have people who know exactly what PRP is, but kind of explain how you pull someone's blood out, spin it down.
Right, and then it's the body is just magical, right? Like the cells, like we have everything that is needed to function.
Absolutely.
We just need to give the cells back the right environment to work. So PRP is the body's natural healing growth factor.
Yeah.
It's
exactly.
It's a
so they just take your own blood, spin it down, pull that, all those growth factors that are in the plasma, and inject it into certain areas.
Right.
So you started doing that.
I started.
So that was your first thing.
Yep. Yeah.
And you saw results because it works.
Yeah, I saw results, and then from there I just kept going and learn about anti-aging, about hormones, and then cellular medicine, and learn about peptides. And now I'm teaching other doctors how to do peptide.
Yeah, exactly. So let's peptides. People are very interested in peptides.
Yeah.
We'll talk about peptides. But your Austin Regenerative Therapy Clinic in Austin.
In Austin.
Yeah. And matter of fact, give them where that is. What's your website? Give it now.
So
we'll give it
it's Austin,
AustinRegen.com. Okay. Austin
Regen,
like regen,
regen.com.
REGEN.com. AustinRegen.com. Okay. So you do some incredible stuff there.
Thank you.
My buddy Ben Greenfield was like, man, you wouldn't believe what she does. So Let's kind of chip off some of the things. I kind of don't even know where to start because you do like V cells, you do stem cells, you do, and there's difference of V cells, stem cells, PRP, this thing called plasmapheresis, right? Where do you want to start?
So I think the foundation, like I really believe in the root cause of disease.
That's what I
and
preach
not just
and
symptom
teach.
suppression, and that the body is one system of multiple interconnected systems. And so they're not isolated. And based on that belief, what I do is I try to address everything in order to give the patient the best outcome. So that means that at the foundation, I address lifestyle optimization. And this is in our concierge longevity program. So we start with, for you, based on your body composition, your VO2 max, your genetics, your lab work.
So you do all this. This you have a longevity program. Meaning I want to live longer healthy.
Right.
And then, so you do this assessment first.
Right, assessment. And then the next thing is, nutrition, workout regimen. And then we move to therapies, fixing the hormones, sex hormones, the thyroid, vitamin D, the cortisol, insulin system. And then on top of that, that's when I add peptide therapy. And then above that are all the advanced regenerative modalities.
Yeah, the stem cells, the V cells, the plasmapheresis. So let's start then, just kind of going in order of what you said, right? Peptides, right? There's good ones and bad ones. I hate GLP-1s. I think we're going to end up in a real problem in 5 years. But what do you feel about that one? I mean, I love peptides, but that's not one of them.
Yeah, so peptide are small
amino acid chains,
proteins, and they act like a signaling agent, and we use them for specific action, and they're wonderful. But you have to use
you stay where you're at.
You have to use peptide correctly, and so the way I think of peptide is more like a big picture. We know now aging is the biggest cause of morbidity and mortality.
Absolutely. And Number one cause of chronic disease, aging. Absolutely.
And we also know now there are at least 12 causes for us to age. And so I designed peptides and lifestyle, nutrition, working out, hormones to optimize and to really target those.
So let's just kind of run through the 12, and then maybe you can make some suggestions on what peptides.
Right.
And by the way, if anyone's wants that, go to the website. Is there a way they can sign up for your program?
Yeah. So there's an intake form, and then we'll reach out. I love what I do, and
I can tell
we have the privilege of being able to provide transformative result. Yeah. And it's really rewarding to see.
Yeah, I can tell.
Yeah.
So, okay, so let's talk about these 12 things that, these are the things that really age us and end up causing disease.
Yeah, so, let's say if you come in and see me, I'll take all the, all the biomarkers, all the information, and figure out what are the top symptoms and issues we have to prioritize. And then based on that, I design the peptide protocol. And typically it's always turn out that we all need to address the metabolic and immune function.
Yeah, of course.
Because
that plays in.
Right.
Metabolic, if you have high insulin, you're going to get fat and not be able to lose it, but you're going to age prematurely. I always say one of the fastest way to age is just spike your glucose and insulin, right? And so metabolism plays a huge role. Immune system, right? Of course,
right?
Because immunity is everything.
It's everything.
We don't think about immunity as aging, but it is because immune system gone wrong produces inflammation, chronic inflammation. Acute inflammation is really good, healthy
Right,
immunity,
right.
but chronic is bad. But that's the immune system.
right.
So yeah, that's where I deal with a lot because
Yeah.
certain toxins obviously have such a profound effect on the immune system.
Right. And then it just leads to all these chronic, persistent inflammation.
Yeah, I all of a sudden it's like this itis, that itis, that, my hair is thinning. It's,
Right.
inflammation could be at the core of that. So talk about some of your favorite anti-aging peptides.
Yeah. So typically I love to start, and it's a safe way to start on everyone, thymosin alpha-1. It's one of my favorite.
Yeah, I put my wife on it.
Yeah.
She's on it right now.
It's addressed that
Immune regulating.
immunosenescence, meaning as we age, the immune system is getting older, just like we age. And that lead to the inefficient, even like cancer cell, and it's regulate it.
I love thymosin alpha-1 for a lot of things, autoimmune conditions, because it has a regulating effect on the immune system, right?
Right.
It helps regulate inflammation. Even people that have mast cell activation, a lot of allergies, it helps.
It's amazing for allergy, for people with hay fever, people with like this chronic fatigue syndrome.
Yeah.
It's really night and day.
Yeah.
And also that age-related decline in the immune system. So giving people thymosin alpha-1 now and then is address that immunosenescence related to aging.
Yeah. So what she means by the immunosenescence is we have literally these immune cells that live too long called senescent cells. And it just causes bad immunity, hyperimmunity and low good immunity. I mean, in a sense.
And
that helps
thymosin
regulate
alpha-1, it modulates the immune system. So I love that.
Meaning
because
it brings down hyper and brings up good. That modulation.
Exactly. And that's, again, the body is so smart and it's very intelligent. And so we have to keep that in mind. And everything that I do, I'm trying to get the body to the right environment so that the cell can do what is how to do best.
Yeah, and again, when you look at you, I'm buying what you're selling. I mean, it's working. Yeah.
Thank you.
So if she's on thymosin alpha-1, I want to be on thymosin alpha-1. Okay, what's another one?
Yeah. So everyone talk about like the repair, regenerate peptides family, BPC 157,
I use it all the
thymosin
time.
beta 4, KPV. JSK copper.
TB500 is just a really good general,
Yeah.
Helps you recover, anti-inflammatory.
It's also great for any neural-related issues and nerve and soft tissue.
Yes.
So it has that flavor. And then BPC is great for bone, joint, ligament, tendon. But orally is the best for the gut.
Yeah,
It's,
oral, So there's the sub-Q little injections, which is more better for your joints.
Right.
I always put it where something's hurting in that area.
Right.
It tends to really make a difference. But the oral ones, what company do you use for your oral peptides?
So I use various compounding pharmacy, even for oral.
Okay.
Yeah.
That's great.
So,
So you're getting some really good stuff.
Right.
Yeah, I love the BPC. I love KPV for gut as well. Those two match well together.
Yes. So KPV for gut, I love the combination of liraglutide, KPV, and BPC.
What was the first one?
Liraglutide.
I don't
so
know
like
that
for
one.
people
low
with
acetide.
liraglutide.
Love it.
And it's a great combination for leaky gut. It's amazing for Crohn's disease, ulcerative colitis, even like the severe cases turn around.
All right. Yeah.
And,
I've never tried that on anyone. So
ulcer, reflux, it's amazing.
Probably OIBS.
Yeah.
Those three you would use in combination.
Right. The combination is amazing.
How do you spell the one that I didn't know?
LAZA, liraglutide. TI.
Okay.
Yeah.
All right. Yeah, that's close enough. Yeah.
Yeah.
So she's dyslexic. I asked her how to spell something. You don't ask dyslexics how to spell things, okay? You just don't. Yeah.
Did I do it right?
Well, that's right. I did exactly what you did. Yes, I flip it too. And so I did what you did. I tried to visualize it. You went right up. I'm like, oh gosh, I know what I just did.
Yeah.
People ask me that all the time. I'm like, yeah, I don't know.
Yeah.
Anyways, It's funny because there's words that I use every day that I could spell today and maybe not tomorrow. Like the word patient, the I and the E. I just flip. I guess. I like protein. I don't know which one. I mean, like it's like I just don't know. It's like some days I can spell it, some days I can't.
Okay, then I don't feel so bad.
Unfortunately, it's like when you can't read and you have dyslexia, you grow up thinking you're dumb, right? It's like so.
Yeah.
It's like you though. I had in my heart to be something in the medical field. I started off in pre-dental.
I work hard.
Yeah.
I used to live in the library.
Exactly. Yeah, I did too. Nothing came easy to me.
And I used to carry around a big Bible.
Yeah, that's awesome. Yeah.
On my day off, I would go to the beach and
So when
talk
did you
to stranger?
So when did you like really become a Christian? And how did that all happen?
Well, I'm ashamed, but I'm not very consistent, and always when I needed help, then I would, reach out to God more and pray more. Yeah, but
you're human. That means.
And I'm aware of that, and I'm like, I really want to be more consistent and have stronger faith, and not just as needed.
Yeah.
But I mean, just throughout my career.
Yeah, I love your honesty. I mean, people reach for God in the bad times and often forget about him in the good, right?
Yeah.
But they could be flipped too. So,
I mean, the first moment that I never forget was like we're floating on the boat, right, on the little raft, and there's like a wave, and suddenly, doesn't matter who you are, we all pray. I know. Right?
Yeah.
And we're like,
there's no atheists in foxholes.
Right. When it comes down to it, life and death, then you you can't help but accept it, and it's just really real. You feel that.
Yeah. So, amen. So okay. Any other peptides? So we talked about some gut peptides.
Them all.
Anti-aging. What are some of your other anti-aging peptides? You said the thymosin alpha one
is amazing for skin tightening.
Say it again.
GHK copper.
GHK-Cu. Cu. Yeah. So GHK is a great one for joints too.
For joints,
but your skin and hair.
Right, because it's a great anti-inflammatory, and even for diabetic with like non-healing ulcer, like a big open wound, topical GHK copper.
Yeah, that's a great one, and even a lot of the skin stuff now
amazing
has the copper
for skin
in it.
and hair.
Yeah, because it really people do a lot of things for collagen. A lot of things don't work, just like eating a bunch of collagen. Okay, it might help a little bit, but that really makes a difference.
Right,
so.
and you combine that with eating right, and that's when the magic happened. And so, in terms of like, what I like for peptides, I think I address the normal way our body function, and that is it's just like a car. We go through the growing phase, or you run the car fast, and then but you have to stop and recharge and
Sleep's
repair,
huge.
Right? So with peptide, I would put patient through a growth phase with tesamorelin, CJC, ipamorelin, sometimes combined with.
So CJC is it helps your body produce growth hormone.
Right.
Tesamorelin, did you say?
The same.
Tesamorelin, same thing. It helps produce growth hormone. Very, very healing.
Very effective for muscle building.
Yeah.
To reduce visceral fat. It also improves lipid profile. It's repair the endothelial function, improving blood pressure.
All of it.
Stronger bone, better lower brain inflammation, leading to better memory.
Tesamorelin, so I love tesamorelin, and it's not testosterone. It's not a hormone.
Right.
It's very safe.
Tell the brain to secrete more growth hormone, which is declining as we age.
Yeah, exactly.
Right.
Yeah, I mean, it's definitely one of my favorites as well.
Yeah, so I would go through that, like up to 3 months of growing phase, and then we switched to working on mitochondrial function, nutrient sensing system, the AMPK system. So,
so some NAD plus.
Yeah, or MOT-SC, which is It's MOTS.
Oh yeah, MOT. MOTC, yeah,
MOTC.
I love that one. Yeah,
SS31.
I say moat for some reason. I don't know why it's not moat, but dyslexic. I am.
We all say it differently, I
Yeah.
guess. And then SS31 is another one. And then we're cycling through thymosin alpha. And then there's a huge category that I love, the neuropeptide, right? So the dihexa, Cmax, C-length, because brain optimization
Cmax is brain.
important.
It's with an S. S-E-M-A-X. Yeah, S-E-M-A-X. Cmax, yeah. I put my wife on that one too.
And it's just enhanced cognitive function.
So Cmax,
memory.
what was the other one you said?
C-length, SELANK.
Okay, C-length.
That is similar to Cmax with a little bit different flavor.
Okay.
It's amazing for people that also have any kind of anxiety, OCD.
Oh, I didn't know that. That's great.
It's great for that.
C-length. Okay.
And dihexa is, so those two are nasal spray. And dihexa.
I have to get those from you because I don't do, my wife, I get the Cmax. So, but I do the injection, but the nasal spray is better because it's right up into the brain.
Right.
Okay.
And then you can alternate or you can do both.
Okay.
Cmax in the morning, C-length in the evening so that it's, calm you down.
There was one more.
Dihexa. That is typically oral, but it could be a topical form as well. And that is just really strong for cognitive function. And what I do is I kind of rotate through, the three.
We all need cognitive function as we age.
Right.
So, those, if your brain stays healthy, your mitochondria stay healthy, then everything, your immune system's better.
Right.
Obviously, your cognitive function, your brain's better. You age slower. It affects everything. Which brings, obviously you do resistive training. Resistive training increases mitochondria. It is, I always say it's like, it is the biohack. Resistive training in particular. It is the biohack for anti-aging. Would you agree with that? And sleep.
Right. We have all kind of fancy tools in the toolbox.
Right.
But the foundation is still food, sleep, and exercise. Exercise has so many powerful pathways that allow us to be optimized.
Yeah, just increasing mitochondria, you can depleted mitochondria, depleted brain.
and
then
run out of
metabolic
energy
problems.
and you're dead.
You're so lean and fit. It's because you carry, muscle, which when you age, you lose muscle.
Right.
And people don't realize. I think the older we get, the more important resistive training is.
Right. And the more protein we need. Most people think the opposite.
Yeah, it's the opposite. The more protein you need.
Right.
Absolutely.
Right.
Yeah. Especially women in menopause. They really need more protein.
Right.
It's amazing to me.
And that's why I'm a big fan of tracking and educating my patient to know what's important, what would move the needles and have them know their numbers and then optimize.
Yeah.
So muscle mass and strength is important.
You check VO2 max in your office?
And I absolutely check VO2 max and track and optimize because that is probably the best correlation. It has the best correlation to longevity. So the higher your VO2 max, the longer you're going to live.
Yeah. It's amazing. This the gentleman that invented this water and the systems to make it.
Yeah.
His oxygen saturation at 75 is 100 all the time. Like he went in and he had this, surgery, knee surgery, and they were like, your oxygen saturation is like spiked at 100. It's just staying at 100. But that, because that anti-ages you.
Right.
So it's pretty amazing. But your hair's better, your skin's better, and your all-around health is better.
Yeah.
And so VO2 max, the higher it is, the more oxygen you can carry through your system. Yeah.
Yeah. So we track that, and then the grip strength, and then in terms of blood work, I track the apolipoprotein B. There's many things, but fasting insulin, the ApoB.
Yep. Which is like, another study just came out. Someone just sent it to me. Another study because the Framingham study's been out there, the higher the cholesterol, the longer you live. And that was the study. Because now when you're looking at the ApoB, that is more specific on what's a problem.
Right.
Yeah, exactly. Right. That's a problem's cholesterol, when you see that out of range.
Right.
And also the smaller particles in the, anyways.
Right.
But
so, I mean, yeah.
just looking at total cholesterol is irrelevant.
It's worthless. Yeah. Right. Yeah. And then homocysteine level, I know you're big on methylation for detox. And so we track that because that is a reflection of inflammation indirectly.
Exactly. Yeah.
So, there's things that if we can do it, we should track and optimize everything, but at least be aware of the big one that can really make a difference.
Yeah, absolutely. Yeah, brilliant. And then, like I said, there's the peptides, et cetera. Okay, now let's step into some of these incredibly anti-aging techniques, healing techniques. One that I haven't done yet.
Yeah.
I've done a lot of things.
Yes.
It looks like I'm coming.
Yeah.
Is the plasmapheresis, plasma exchange is what it's known as. Taking young plasma from someone young and healthy and giving it to someone who's older or aging. Explain this.
Yeah, so let's go from the beginning, and it's really fast.
Exactly.
So it's all started with the main study. It's called the parabiosis study in Berkeley in 2005, where they surgically hook up the two rats, and it turned out something in young blood that make the old mice smarter. The skin
better.
is
Hair
shinier
better.
and black instead of gray, and the muscle regenerate and they heal faster, and the inflammation markers reduce, the mitochondrial function improve. So based on that, that started the whole journey, all the curiosity. So what's in the blood? And so then Stanford did a study. They look at they did the young plasma exchange. So they give people with Alzheimer's, dementia, and Parkinson's disease young plasma. It's a small study, but it was proven to be safe, well tolerated, and people did improve in their function, the daily function activity. But there's multiple animal study showing that even when we remove old plasma, the animal started to act young again. And that meaning inflammation markers going down, senescent factor going down, the stem cell that was kind of dormant become active again. And then they started to regenerate faster, heal faster, And so then they go further and they look at the young plasma. And it turned out young plasma has more regenerative protein. It has more signal to promote stem cell to be activated. It's anti-senescent. It promote mitochondrial function versus as we age,
you start losing it.
Yeah, as we age, it has impaired mitochondrial function. We all know that.
And these are like signaling molecules, keeping it simple, cell factors, et cetera, that do all these messaging.
Right.
Keep your mitochondria working healthy, making energy, et cetera, which makes your brain work better, et cetera. Right. And all these factors, but as we age, we start losing these communicative factors, right? And so if you exchange the plasma, you regain that. And that's why the old mouse got young.
Right. Yeah. And it, that.
And by the way, the young mouse in that study actually had aging signs. Right. Because that plasma went into this mouse. Remember, they sewed their blood supply together, and one got younger and the other one got older.
Right. Because the old blood has a lot of inflammatory factors, a lot of senescent inducing factors.
It was affecting the young rat.
Yeah. So it's fascinating. And so now we realize that aging is more like a systemic, and it's that signaling, that tell the cell, hey, we're old, let's act old. Yeah. And then when you give young plasma, the cells get the message to
Act
act young again.
Act young again.
And plasma is kind of like a huge signaling organ.
Mm-hmm.
I would think of that because all cells are bathed in plasma.
Mm-hmm.
And as we age and with the environment we live in, what happens is we accumulate microplastic,
Mm-hmm.
mold, toxin,
these things
chemicals.
they store up in our tissue. They accumulate all these toxins from the womb to the tomb. And guess what? All these factors keep going lower and lower and lower.
Lower, and higher inflammation,
Yeah.
leading to this chronic, persistent inflammation, and that lead to everything. Abnormal methylation, then it further making detox harder and harder. So it's just like a vicious,
She's right.
vicious cycle. So TPE is a therapy. It stands for Therapeutic Plasma Exchange. That is where I'm gonna hook you up in a machine to take your blood.
We'll videotape this.
And take your blood
if I can get it done before this airs.
Yes.
I know, because I've never had it. It's amazing. I never had it. So we hook it up, and then we're bringing in...
Bring your blood through a machine, and it will separate out the plasma, and then collect it, and then we're going to throw that away.
Right. My plasma, bye-bye.
Right. It's the
plasma.
old dirty oil.
Yeah.
Trash.
So how do you choose, where do you get your donor for new plasma?
And then young plasma is where, we get that from a AABB accredited lab, and they screen for qualified young donors age 18 to 25, which is kind of like the peak of human.
My only fear here would be 18 to 25-year-olds, these are the sickest group of people on the planet right now. Unfortunately, sorry, guys and gals, but it's true. I mean, it's like, how are they finding these donors?
Yeah, so...
And I don't want one that's been COVID vaxxed either.
Right. So I see your concern, but it's very interesting that in the plasma of young donors, it turned out their lifestyle does not really influence the youth.
Just they're young.
Yet. Yeah.
Well, that's a fact, right? I mean, even if they are unhealthy in the sense that, because you look at this generation and I mean, they really are an unhealthy group. But what you're saying is they still have all the young factors. Is there a way, so when they get the plasma, is there a way that they're just isolating, what is, I guess what I'm asking is what does the plasma contain?
Yeah. So in whole blood, roughly 45% is red blood cells, and that carry oxygen. And then there's less than 1% are white cell counts, white blood cells. They fight infection. And there's this platelet. And then this 53 to 55% of whole blood is plasma. And the majority of that is water, but that 10% is a rich cocktail of proteins, hormones, cytokines, and most importantly, these amazing extracellular vesicle or exosome. And it turned out there was a study in 2024 in rodent showing that it's the exosome from young plasma that signal the cell to act young, and it's shown that it has better mitochondria, energy, metabolism.
Yeah, of course. I've been studying cell factors, which are in there as well, right? In the plasma, where there's, I mean, again, they're communication molecules. They're telling your cells to be young, act young. You said that. I thought it was a great way to say it. Right. Teaching them to be young. Right. Teaching them new habits. Right. We got to get rid of the old guys. Right. We got to bring in this new group. That's so what you're saying is in that they're able to isolate that. So in the only thing that determines good is young. Right. But they're still screening these people. So if someone was COVID vaxxed, would that have any play on their plasma?
Yeah. So in the screening process, they don't ask for if you had COVID vaccine or not. But we know that after you get a shot, it's kind of gone through your system like up to 4 to 6 weeks.
Yeah, but some people are left in what we call spike protein persistence, where
Right.
literally they're continually producing spike protein. Right. It's coded in their dang DNA now. Right. So that's I don't want that.
Right. So for a patient that raised that question, we know that plasma infusion has been around for a long time. And even since COVID, there's no data proving anything
is transferred
harmful
into the plasma.
Right.
Right.
But,
Yeah.
that's the data. And, people is always like, this is a fact. This is what we don't have all the information or don't know. And then, you decide. I have 5 liters of young plasma in me, and I feel amazing.
That's amazing.
And even when you have your old plasma
working.
removed, people feel better within days.
Yeah. Just because your body's forced to rev up the production of those things.
Right.
Yeah, just plasma removal is.
And also to be able to remove all the inflammatory products, right? All the senescent
You're getting
factors.
rid of all these immune cells that are hyperreactive, driving bad inflammation. And then you're getting rid of all these other, factors that are signaling poorly, right? Getting rid of them.
Right.
Yeah.
And I love young blood because it has the ability to alter the age-related change in gene expression, and then it
turns bad genes off.
It signal the gene that was silenced by aging plasma to be active again.
Yeah.
And
you'd still have a thyroid if you'd have known this, by the way. You know what I'm saying? You only know what you know at the time, right? But my point was you could have downregulated that gene.
Right.
Yeah.
Right.
Yeah.
Yeah.
I mean, it's pretty cool because I think you can take stem cells, I do and have, but the plasma has a lot of stuff we haven't discovered yet.
Right. Including, I love stem cell, but when you remove old plasma alone, that already remove, the inhibition factor to suppress the stem cell. So when you remove that, the dormant cells now get the signal to be active again, and then young plasma is going to the next level.
Yeah.
And then, if you do that, so let's say, you plan on having another round of stem cell, I would definitely suggest that we remove your plasma.
That makes so much sense.
Before we do stem cell.
Bring it in.
Yeah.
And then these cell factors I was telling you about, right? Removing that and putting all these factors in. Oh my gosh, like we have something here.
And then new stem cell is another thing that I'm excited about. And so that's, coming up hopefully.
Yeah,
soon.
Absolutely. So you do something else called V cells.
Yes.
I know Todd, Dr.
Yes,
Todd, right?
yes.
Yeah, the singing.
He came to my office and we did the combo.
I've never had the V cells. He offered them to me. I just could never.
Well, that's
there.
what you're gonna get when you come to
so I'm
Austin.
Yeah, they're pretty remarkable. But explain what these V cells are.
So V cells stand for very small embryonic-like cells. So they are cells that we still make as adults, but they circulate around dormant. They're not doing anything. Yeah. Only under stressful situation, they become activated. But in this situation, we manipulate that. Dr. Todd figured out there is a laser system that can turn these cells on.
And you have that in your office.
We have that. So the way to do it is I'm going to collect blood, separate out those dormant cells. In the test tube, we shine the laser to turn them on, and then we'll put it back through your system, and we shine the laser to guide the cells to where we want them to go.
You put it on the brain if that's where you're trying to.
We target different area of the brain, and then the thymus gland, thyroid gland, your pancreas if needed.
Regulates immunity.
Right. And then for men, young men, we also target the testicle for sperm formation.
The young men. What about the old men?
We don't care.
Yeah.
Women don't care about testicle. So these cells are very small, so they can totally cross the blood-brain barrier. So that's
what makes
another
them
thing.
part of their uniqueness.
Right.
Yeah.
And they have the ability to turn into many different cells, but they stop before they can turn into tumor,
which is
teratoma.
Yeah, which is unique as well.
Right.
Yeah, and it's a pretty easy process because you're not.
And it's from your own.
Yeah, exactly.
blood.
So let's say hypothetically someone had a knee problem. Of course, we could put stem cells in the knee, but you give these things systemically, then you would put the laser on the knee and draw that to the knee. Interesting. Yeah.
And in reality, I'm a fan of combination of targeting, you know, giving the cells, the body, everything's needed. So, you know, we do systemic and then local injection with, you know, young plasma, V cell, exosome, and
That's
laser.
True. You could even inject young plasma.
Yeah.
Yeah, that's, I didn't think about that.
I use that for skin, for hair, and my favorite is for sexual optimization for men and women. That is
Why is that
a
your favorite?
topic because I'm very passionate about sexual health because healthier sex leading to, you know, better health.
True,
And
it's true.
It's a personal journey because, you know, I was busy working, 2 kids and career, and next thing I know, I told my husband, I said, I love you, but I'm asexual now. I have no desire, and I understand if you leave me. You know, that was before I knew anything about, you know.
Okay, so
hormone
you're talking to some people out here right now, right? So I'm so glad you're open about it. Let's explore that just a bit. So you changed that then. Okay.
Right. So, you know.
But you had no sex drive, it sounds like.
I have no sex drive. And then as a woman, I felt angry and guilty, and, you know, like I was hoping that my husband would approach me, and then I would turn him down, and then I feel horrible. I feel guilty, and it's just not good.
No.
But, you know.
It's bad for relationships because then he starts to feel it's him.
Right. The rejection. And hormone influence is strong, right? So now I educate my female clients, you know, I'm like, it's not you. It's your hormones, but it's totally fixable.
Yeah.
Right.
Yeah. And are you using peptides a lot too with that even?
I do a combination. So hormone, peptides, you know, even
I'm
vitamins and
I'm
minerals.
not one to recommend hormones for people. Time and place, of course, right? I'll acknowledge that always. But one of the problems with hormones, 2 problems, is that it stops or slows dramatically your own production.
Right.
And then also when you're giving a hormone, you're kind of, you know, bypassing innate intelligence. We're giving, you know, we're creating a steady supply as opposed, if you looked at estrogen, progesterone, testosterone, it's up and down throughout a day. Even thyroid hormones, higher in the morning, lower in the, you know, so we kind of take out innate intelligence. You know, what's your feeling on that? Yeah.
So personally, and I've seen with a lot of my patients, people feel better and they are healthier. And there's a lot of data supporting the preventive benefit, meaning for both men and women, you lower the risk of dementia, depression, stroke, heart attack, prostate cancer, breast cancer. We used to think testosterone lead to prostate cancer, but it's opposite, right? So personally, I mean, you know, it fixed that issue and motivation for life, the energy, you know.
What do you think was the big contributor for you just being so hormonally off?
Age and stress.
Yeah, your stress level was, you know, because I mean, I'm always like, hey, fix that, and you know, you could turn your body around. But you're running at a high level. It sounds like, you know, so
and you know, I have 2 boys. My second boy, when he was 2, he was diagnosed with autism, and
you vaccinated.
And as a mom, and as a mom, I signed him up.
Would you do that now?
Autism,
now,
autism program. And then I'm like, there's something else that's missing, right? So I order, because I'm a physician, I order an MRI and MOA for him. And it turned out he also had moya disease.
Yeah, I read that.
Yeah. So talking about stress, right? So that was,
God, that's a lot of stress. Yeah.
Job and 2 kids and dealing with that, just the emotional and the reality of having, luckily he's very functional now.
Yeah.
So from pain to purpose, it's just like, it never ends. You just learn more and get stronger and more wisdom and more open.
Yeah.
Yeah.
Isn't that true, right? So, okay, so the V cells, what are some of the most incredible things you've seen with the V cells?
So personally, I do everything that I offer, right? And I had, the first time I had V cell, the 3rd day after, I was able to read without my reading glasses. And even at night, we went to a restaurant and start. That didn't last long though. But that's something that does help.
Do you know that I used to wear glasses? People would see me with glasses on. They say, why don't you wear glasses anymore? Because like all the stem cells I've gotten, I got my vision back.
Yeah.
This eye's like corrected. And then this one's probably a negative 1.25.
Yeah. I'm just excited about stem cell exosome, and in the.
I wish my hearing got better. It was like, I have damage in this year. So like this year is harder to hear out of, but my eyesight got better. My
That's
ears
amazing.
didn't, but my eyesight.
Mine,
I still have gray hair too.
Yeah, that too. So we need to figure out how to.
Yeah, exactly. Yeah. We'll put that young
mitochondria dysfunction.
I don't even mind my gray hair anymore. But to me, though, what I do mind about it, it's still that sign of like, my cells still need to think they're younger, right? It's like, so.
Right.
My dad was fully gray in his 30s. I was graying in my 40s. So, I'm blessed, I guess.
You truly look amazing. So I can't wait until you have,
I can't wait. I mean, I've had such positive outcomes with everything regenerative. I think your clinic's really unique in that you do a lot of the top stuff, and you do. And something, because of your history, there's something about that it makes you that much, I don't want to say trusting, that much more powerful, that much more, you're someone of focus. You're someone of great detail. You're someone of great, it's like, I really believe that what you went through has made you the great physician that you are. I believe that. And that's what I love about you.
I love to, I live and breathe, new knowledge.
Yeah.
It's a fine line between waiting for 20 years for something to be approved versus just do anything without any, science to back up. So it's a fine line.
Yeah.
And so I just have to be very dedicated, and I really enjoy that and try that for myself.
Yeah, I'm the same way, but I sense that from you, and that's what I'm really, attracted to. And you do something else in your clinic. You do this microneedling infrared. To tighten skin and bellies and things like that. Talk about that.
So we do a combination. It's a combo. So we have radio frequency microneedling. So that's like a controlled.
Do you do this on the face too?
Face, the whole body.
My wife's gonna be like, okay, I want that.
Yeah, face and body, and then that, and then we also have this sub-ablative laser. Again, that's kind of controlled thermal injury. It skips the surface and it go deeper to stimulate collagen production. And then we do injection with exosome, PRP, like different option, V cell. And then I also combine that with the salmon sperm DNA.
Oh yeah,
which
yeah.
I love.
That was my other question. You do the salmon
Salmon sperm
DNA.
DNA. Yeah.
What the heck is that? Now I know that they use salmon skin or fish skin like on bad burns and things because it regenerates the skin like that. Is that kind of the same thing what we're dealing with? Okay.
It really signal regeneration.
Mm-hmm.
Yeah, and so we put that all over the face and body.
Oh my gosh.
Yeah. So that now is known as the Ben Greenfield package or protocol. And I'm sure we're gonna have a Dr.
Pompa protocol.
Yep.
Hey Ben, no offense, but Pompa protocol sounds better. Yeah. So we're gonna come up with one because I already have something else I'm gonna add to this. I know it. I know what this is.
Yeah.
Okay, so it's gonna be the Pompa program. We have to outdo Ben. I love Ben. But
because then you walk out and you feeling good. You have different modality to naturally reverse aging, and it's exciting that with what we talk about the use factor in young plasma or the signaling molecule. What it means is that aging is potentially reversible.
Oh yeah,
right?
Exactly. Yeah,
it's a modifiable cellular process.
Yeah,
absolutely. And that's I'm very excited about that.
And that's what I want people to heal. I do want people to heal.
Yeah.
That's what I want people to hear is that it is, reversible. And here's the good news too. It's getting cheaper.
Yeah.
I mean, come on, even 10 years ago, it's like, this was just for the wealthy. Now it's like, come on, it's getting to the point where it's going to be for everybody.
Right.
It's exciting.
And then everyone can start where you're comfortable with, and then just go from there.
I know, exactly.
Even just sleep better.
Yeah.
Eat healthier, just drop the junk food.
Yeah.
And then just go from there.
Yeah.
Because I think when you have easy win, it just build on that.
That's true.
And
it is true.
And the body is the best investment to invest in your health and in your health.
Absolutely.
Your physical, your mental function and your sexual function.
Yeah,
too.
exactly.
I have to squeeze that in.
Yeah, no, because I mean, to your point, right? That changed your relationship. That changes your life. In other aspects of health, sex is very, very important.
Right.
It really is.
Right.
Yeah. I mean, too many people are not able to really, experience it, let alone enjoy it at the level that they should.
Right. And I think that would be a miss, because if there's non-surgical, easy, natural way to optimize that, why not? Right?
Mm-hmm. Yeah. And what she's saying is a lot of these things are injected into, we'll just call it the privates, right? And male and female. Mm-hmm. And because circulation is part of the big problem. Right. And that can change that dramatically. Right. And you do that in your clinic, all that.
It's the full package.
It's the
we package. Do hair, skin, brain, right?
Right. Yeah, hair. Okay, I was going to go hair because that's your natural hair?
Yes. Okay, yeah. Most people ask if I have hair extension.
Yeah. And I can tell you don't. That's why I wasn't afraid to jump in there.
And I have to say, with age, my hair is getting thicker, instead of the
thicker.
opposite.
It's getting thicker because of what you're doing.
Right.
Yeah. I mean, your hair is amazingly thick.
And so it to me, it's very exciting while we're still, on Earth, to do the best we can to, have the best quality of life.
Yeah,
and
exactly.
That's already, as of now, we have so many tools.
Yeah, that's true.
To achieve that. And I think that's really exciting.
I know.
Yeah.
What are your workouts like? Stand up for real quick. Just flex your legs. Look at the 58 years old guys, okay, girls.
Thank you.
Yeah. So what's your workouts like? You look
amazing. So I take a day off, and I do anywhere from 3 to 5 days of resistance training.
That's me. Yeah. I would love to do 5, but typically it's 4. But
yeah, I do 3 to 5, and then I do HIIT training.
That's what I do. That's high intensity interval training. That's what I do.
Yeah.
I recently did a solo podcast on, menopause, and I was saying, look, it's high intensity training. It's resistive training. Forget about the endurance stuff. Right. Higher protein. Right. I mean,
high protein is key.
Yeah. I talked about the peptides that we talked about. Yeah.
Right.
So.
And when you stack all of that,
Magic happens.
Magic happen, six pack when you're 70 plus and,
Yeah, you do have a six pack too.
I do.
Yeah, I mean, you just tell you do.
And I want to add more stretching and yoga.
Yeah, it
to
bores
that.
me. Yeah, I love resistive training.
Me too.
It's
Me
like
too. Me too, and it make you feel good, right? It's like
exactly.
I never regret a good workout.
Yeah.
So.
No, I mean, and again, the older you get, the more important it is because it protects the joints, makes your joints function better. Increase mitochondria, affects metabolism, affects your brain.
Right.
I mean, everything.
Right.
So
yeah, bone health, not a lot of people focus on, but it's super important.
Yeah.
And to have strong bone, it's the muscle contraction.
Wolf's Law. Do you remember from our medical background, right? Stress a bone and it gets stronger.
Right.
It's a law.
Right.
It applies to every human, whether you're 100 or whether you're 20.
Right. Right.
Yeah.
And that same principle, that hormesis, just a little stress.
One of my favorite topics.
Yeah. So I do, I have a cold plunge and a sauna and a PEMF machine at home. So every morning I do just quick.
Yeah, that's right.
A minute of cold plunge.
Because she's respecting hormesis, right?
Yeah.
You don't need a lot. If you do too much, it becomes bad.
Right.
Yeah.
And then just listen to your body.
Yeah, exactly.
Yeah.
Listen to your body. Have you heard me talk about that? Yeah, I talk a lot about that.
Yeah. And I think that would guide you to, are you doing enough? Is it too much?
That's right.
Because either people don't work out enough or they
or they're
don't
doing too
have
much.
Recovery.
Yeah, exactly. The recovery is key.
And that's my issues.
Yeah, exercise. That was your problem.
Right.
I think that was crushing your sex drive, right?
Yeah, and then chronic inflammation from not adequate recovery.
How old's your husband? 20?
He's my age.
Yeah. Okay.
Yeah.
I was joking, meaning like, it's like, yeah. You got to keep up with her. She needs a young guy. Know that he's an orthopedic surgeon, so he's busy.
Yeah. Yeah. But yeah, so this is fun. It is fun. I get excited.
Me too.
Talking about
I know.
this.
I love it. Well, give your clinic name again. Tell them where to find you.
It's Austin Regenerative Therapy, and it's in Austin.
Yeah.
Austin, Texas.
And then you said, and it's in Austin, Texas. And then you said, which is easy to fly in and out. It was Regen.
AustinRegen.com.
Okay, AustinRegen.com. So what a pleasure. I learned something. I'm so excited. I'm taking my aging to another level, or anti-aging to another level. So,
I can't wait to see you.
I know. All right.
That
You're
way
going
I
to see
can
some
show
of them.
off.
You're going to see some of them too.
Yeah.
Awesome. Okay. Share and like the show. Everybody wants to anti-age. And guess what? We're all aging. So we got to slow it down. Remember, the number one cause of all chronic disease is aging. And you know what? People don't understand what's out there. The regenerative medicine has come so far and it is accessible to everybody. People just don't know. That's why they need to share the show.
Yeah.
Awesome.
Yeah,
Thanks
absolutely.
for being here. Yep.
Thank
You're
you.
awesome.